So why is mirtazapine or Remeron an often overlooked antidepressant? Well, in today's video, we're going to talk about that. There are many factors of why it's overlooked, and we're going to talk about everything that you need to know about mirtazapine or Remeron. So let's get into it. So starting with number one, what is mirtazapine? Well, mirtazapine is an antidepressant. Now, it works very differently than your other typical antidepressants like the SSRIs or SNRIs, where they work on the reuptake and transport system, blocking that, creating more of those neurotransmitters available in the synapse. Now, mirtazapine doesn't work in the transport systems. Instead, it antagonizes several different serotonin receptor sites, and specifically it antagonizes the 5-HT2A, 5-HT2C, and the 5-HT3. Now, by antagonizing these specific receptor sites, it actually increases norepinephrine and then has downstream effects to increase dopamine. Now, the 5-HT3 antagonism also has some effects in our GI system, where it actually can help with nausea and those who have problems with loose stools. And therefore, there are not a lot of GI upset as a side effect with this medication. So if you're a person who can't tolerate SSRIs well because of the gastrointestinal upset, you may be able to tolerate mirtazapine or Remeron much better. Now, it's also an alpha-2 antagonist. And by also blocking the alpha-2 receptor sites presynaptically, it actually increases serotonin and norepinephrine. It also blocks the histamine 1 receptors, and if you recall from the video on Seroquel, blocking the H1 receptors has a lot of sedative effects, so it's often used for sedation or for people with insomnia. Now, this medication does come in tablet form and also disintegrating tablets. And so what is it used for? Well, mirtazapine was FDA approved in 1996, so it's an oldie but a goodie in some ways. And its FDA approval is for major depressive disorder. Now, it has many off-label uses, and because of that H1 blocking where it causes sedation and also has some anxiolytic effect, it's used for insomnia, generalized anxiety disorder, panic disorder, and post-traumatic stress disorder. So how long does mirtazapine or Remeron take to work? Well, if you're looking for that sedative effect, anxiolytic effect, and even to help with insomnia, it's gonna work right away. And this is typically seen in the smaller dosages, 7.5 to 15 milligrams. As you increase the dosages, you actually are gonna get more of that norepinephrine effect, and so it's gonna be less sedating. And with a therapeutic dose around 15 to 45 milligrams, the antidepressant effects are seen within 2 to 4 weeks, but like other antidepressants, it can take up to 8 weeks to see full benefit or therapeutic effects of this medication. And that leads us to number 4, is mirtazapine addicting? Well, it's not addicting, but just like I mentioned in my video on antidepressants and addiction, it can have neuroadaptation effects. And when you're modulating neurotransmitters, this can happen and lead to a withdrawal effect or withdrawal symptoms when you rapidly discontinue the medication. So you do have to take it very slow when coming off this medication if you've been on it for some time. Usually over 3 months, you have to start looking at tapering the medication. However, there are some people who are a little more sensitive to that and will need to taper slowly no matter how long they've been on the medication. It just depends on how you're metabolizing it and also other underlying factors and root causes that could be actually a cause of your depression, which I talk about in this video on why your antidepressants aren't working. And so number 5, what are those side effects of mirtazapine or Remeron? Well, there's the black box warning for suicidal ideation, and this can occur in those 24 and younger. So if you start having emerging suicidal ideation or thoughts, this is an emergency. Contact your doctor and go to the emergency room. And so common side effects of mirtazapine or Remeron that's seen in greater than 5% and more than twice of that of placebo are the following: somnolence or sedation, increased appetite, weight gain, and dizziness. And now that weight gain is a big factor and why a lot of prescribers will overlook mirtazapine. And though the FDA label states that 12% of patients experience weight gain, that was a short trial and it's actually more than that. And in my experience, I see about a third of patients having weight gain with mirtazapine. So it is a big factor to consider. Now, less common side effects are dry mouth, constipation, and sexual dysfunction. And now the FDA label did not mention sexual dysfunction or sexual side effects at all, as it was seen that mirtazapine didn't really have any effect in this area. However, later studies came out, and depending on which studies you looked at, the percentage could be anywhere from 18 to 30%, but when you compare that to other antidepressants, it's actually significantly less. Now, some rare side effects to consider with mirtazapine is agranulocytosis, which is abnormal white blood cell counts, and photosensitivity. So you may have sensitivity with the sun. You may need to wear sunglasses or even make sure to cover your skin up with sunscreen. High cholesterol levels, elevated liver enzymes, angle closure glaucoma, and QTc prolongation, which is that waveform that if it prolongs, it can lead to cardiac dysrhythmias. So you have to be careful there. With all of these, bottom line is to get your labs checked. So make sure you're checking for, your complete blood count, your liver enzymes, making sure that your white blood cells are not abnormal, the cholesterol, lipid panel, all of that should be checked prior to starting any medication. And also getting an EKG in this circumstance would be beneficial, especially if you have a history of cardiovascular conditions such as arrhythmias. So now let's talk about drug interactions. Now, mirtazapine or Remeron is primarily metabolized by the CYP3A4 and secondarily metabolized by the 2D6 and 1A2. So you have to take caution with strong inhibitors and inducers of that 3A4 substrate and enzyme, and make sure that if you're on a strong inhibitor or inducer, that you're talking with your provider about that and making sure that your dosages of mirtazapine are adjusted accordingly. And also always make sure to do your own drug interaction checks, as these are just a few of the inducers and inhibitors of that substrate. Now, you also want to avoid the use of the MAOI inhibitors, because these antidepressants can actually put you at an increased risk of serotonin syndrome and hypertensive crisis. You also want to be careful with drugs that decrease the seizure threshold, as mirtazapine can decrease seizure threshold. So when you combine it with other drugs like other antidepressants like bupropion and so on, you can actually increase your risk for seizures. Also, speaking of pairing it with other antidepressants, this is actually common practice with mirtazapine, because when you pair it with an SNRI or a serotonin norepinephrine reuptake inhibitor, you really enhance that norepinephrine action of this medication. You can also pair it with bupropion to get a very similar effect, and this is termed California rocket fuel, because it can really boost that norepinephrine and give you a lot of energy, boost your mood, etc. But caution has to always be taken when you're doing these combinations, as serotonin syndrome is a risk factor. Now, you also want to avoid alcohol, because not only is alcohol a depressant, but it will actually also further that sedative effect of mirtazapine. And now my final thoughts on mirtazapine or Remeron. Well, mirtazapine has a lot of efficacy for treating major depressive disorder. And the reason it's often overlooked, as I mentioned earlier, is the weight gain factor. Weight gain is huge with mirtazapine and has to be something that is considered. And so now a lot of practitioners are only using mirtazapine in small dosages to help patients with insomnia, and then using other antidepressants in the morning adjunctively to help with the boosting of the mood and energy, such as bupropion and the SNRIs. However, I find mirtazapine very effective as a solo treatment for patients with depression and anxiety mixed, because it has that sedative and anxiolytic action. And it's also even more effective for patients with irritable bowel syndrome who also have depression and anxiety, and the loose stool or diarrhea form of irritable bowel syndrome. It has been shown to be very effective for patients with that because of that 5-HT3 antagonism. So there you have it. That wraps up my review on mirtazapine or Remeron. Have you taken this medication before and have experience with it? Please let us know down in the comment section below, because we learn from sharing each other's stories. And as always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you all next week.